If you've been treated recently at the Queen Elizabeth Hospital Birmingham for a confirmed cardiac problem within the last 6 months, there are specialist rehabilitation services available to you to assist you in your recovery.
Through the Healthy Heart programme, the Cardiac Rehabilitation team at University Hospitals Birmingham can provide a gateway to a range of services that can help you on your way to recovery. The programme is open to all cardiac patients, and you can bring along a friend or family member too. It is a good opportunity for you to meet other participants with similar conditions or having had similar treatments. An important focus is on education. At our classes, you will have the opportunity to meet all of the specialists involved in rehabilitation. You will have the opportunity to ask questions and access specialist appointments if additional support is required. An important part of cardiac rehabilitation is exercise. Exercise can offer many benefits that can be achieved in many different ways. Any physical activity is good, but there are positive benefits for the heart if you do the right type of exercise. The Cardiac Rehabilitation Exercise Programme will give you guidance on what exercise is best for you. If you are assessed as suitable for cardiac rehabilitation exercise, the team will be able to offer you structured gym-based exercise sessions. You will have the opportunity to discuss your exercise needs with a physiotherapy specialist on a one-to-one basis. Tai Chi classes are also available if it has been recommended that you do a lighter form of exercise, or if you would prefer it. If your circumstances prevent you from committing to a gym-based class, a take-home DVD is available to enable you to continue your rehabilitation programme in your own time at home. Dr. John Townend, a consultant cardiologist at Queen Elizabeth Hospital Birmingham, was interviewed and questioned about the importance of exercise and looking after your heart.
Dr. Townend, can you tell me why you think exercise is such an important part of cardiac rehabilitation?
I think because it gives patients real confidence to get back to their normal activities following their heart attack or heart surgery, and also, of course, because it benefits their underlying heart disease. It has good effects on things like blood pressure and cholesterol.
And who should be taking part in the exercise?
Anybody who has had a cardiac event and who can exercise, even if it's only to a low level, will gain real benefit from exercise.
And what would you expect those benefits to be?
I think threefold. I think the first thing is it allows patients to get back to their normal activities. Secondly, it provides them with the confidence that is often lost after a heart attack or heart surgery. And thirdly, of course, the effect on their heart disease is very good for them and really reduces their chances of running into further problems with more heart attacks or more adverse events.
After listening to this information, if you feel this applies to you and now is the right time to take up this offer, please speak to your GP or practice nurse so that they can arrange for you to access these beneficial services.
Once you are at home, it is important that you look at your lifestyle and gradually build up your physical activities before you start your rehabilitation programme. But remember these important points. Physical activity. The heart, like any other muscle, needs physical activity to keep it in good condition. Physical activity can help you to lower your risk of injury, reduce your blood pressure and cholesterol, improve your control of blood sugars if you are diabetic, enhance your feelings of well-being, confidence, reduces mood swings and feelings of depression, increase your energy levels and promote sleep, improve your muscle strength, suppleness and movement, reducing your body fat and help maintain a healthy weight, reduce your risk of further cardiac problems. High blood pressure. Reducing your blood pressure can lower your risk of having circulatory problems such as heart attacks or strokes. Lowering your blood pressure can be achieved by doing regular physical activity, controlling your weight, having a healthy diet and reducing your salt intake, cutting down on your alcohol intake, and if you smoke, aim to try and stop. Taking your medications as prescribed. High cholesterol. Cholesterol plays an important role in how every cell works throughout your body. The most common cause of high blood cholesterol is related to eating too much fat, especially the saturated fat in your diets. Cholesterol levels can be reduced by doing regular physical activity, taking your cholesterol-lowering medicine. These are often a long-term and effective form of treatment. Following healthy eating advice. Eating healthily can help to lower both your cholesterol and your blood pressure, help you maintain a healthy weight, and reduce your risk of developing illness. Ways for you to eat well to protect your heart include: choose the healthier fats in your diet. Cut right down on saturated fat and replace it with more monounsaturated fats and polyunsaturated fats. Reduce trans fats in your diet. Eat plenty of fruit and vegetables. Cut down on your intake of salt in your diet. Eat oily fish and other foods rich in omega-3 fats. Moderate your alcohol intake. Make sure your diet is high in fibre. Smoking. Smoking is one of the major risk factors for coronary heart disease, as well as contributing greatly in the development of other arterial diseases, cancers, lung disease, or breathing difficulties. If you stop smoking, your health and lifestyle will benefit, for example, by reducing your blood pressure and heart rate, which will reduce the effort your heart has to make. Improving levels of oxygen in your blood, reducing the risk of you suffering further cardiac problems. Your lungs will be able to clear mucus and debris, improving your breathing, and this increases your energy levels. Your taste and sense of smell will improve. The appearance of your skin and teeth also improve. You will be protecting those around you by not exposing them to second-hand smoke. You will save money. The more you smoked, the more you will now be saving. You will no longer smell of stale tobacco. Most importantly, you will reduce the risk of developing illness, disability or death caused by cancer, heart or lung disease. This will continue to reduce further year on year. Medications. Medicines are an essential part of your ongoing treatment and offer your heart protection. Ensure you are taking your medicines as prescribed and that you have adequate supplies. It could be dangerous to stop taking your medicines without medical advice. If you get any unwanted side effect, you should not stop taking your medications without discussion with your GP or hospital consultant. Driving. Initially, there may be some restrictions relating to your driving following diagnosis of a cardiac problem. In most cases, this is only temporary and driving can resume after the recommended period set out by the DVLA. Check with your GP or cardiac rehabilitation team if you are unsure. You will need to let your car insurance company know what treatment you have had to make sure that your insurance is still valid. If you hold a special licence, you will need to discuss this with the DVLA and your GP or hospital consultant, as there will be a procedure outlined for you to reapply for this.
For previous patients who underwent the course have talked about their personal experiences. Here are a few excerpts from them. I think you'll agree they're very positive about cardiac rehabilitation and how it helped them.
It is most important that if you have any heart problems and you are in hospital and the rehab team come to see you, you must, in my opinion, go along with them and do your rehab for a number of reasons. One, you come into contact with other people who've had the same problems as yourself. Two, you will gain confidence by going, and you will be thinking before you go there there's things you probably will not be able to do, and you'll be greatly surprised at the things you can do. They will show you the right ways to do the exercises and how to keep doing the exercises. And then when you're home on your own, after the rehab team are finished with you, to carry on doing these exercises in the right and proper way. I have to say, in the time I did my cardiac rehab, how enjoyable it was. I know from speaking to other people who were there, When they were offered the opportunity to do this, one or two didn't know whether to take it up or not because of other things in their lives. But I can assure you, you really must do that, because it really does, once you're into the program and you put yourself in the mindset of that you're there to get yourself fitter and to do your heart some good, you will enjoy it.
It introduces you to a very, very gentle exercise program that you do in your own home. Very light step-ups, very particular cardiac exercises which began to give you the courage to think, this is a problem that I'm going to get through.
And over the period of 8 weeks, I'm pleased to say that I managed to double my fitness. I can't tell you how pleased I was to achieve that. I found the whole rehab experience very reassuring and very enjoyable. I look back on it with great affection. I'd like to say a few words, if I may, to some of the female patients watching this DVD. A lot of ladies are not used to exercise, or they're frightened of a gym environment. They perhaps feel that they need to be a gym bunny in order to qualify. It could be that they see heart conditions and heart attacks and all of the surgery involved with that as largely a male domain, and therefore that they might feel out of place. Whatever the reason, if there are ladies watching this DVD who haven't as yet followed up on their rehab, I would encourage you strongly to do so. If you can go to the classes run at the hospital, all well and good, because take it from me, you will really enjoy it. It's not frightening and you'll get lots of encouragement.
Do go on the programme, do take it up, because the big thing for me, apart from the physical thing, which in a way is straightforward, was the psychological experience, because I was very anxious, and that anxiety, with the fitness, the anxiety diminished.
After listening to this information, if you feel this applies to you and now is the right time to take up this offer, please speak to your GP or practice nurse so that they can arrange for you to access these beneficial services.